I see it's 11:30, so I want to welcome everyone to day 2 of our annual Health Literacy Conference. My name is Rachel Roberts, and I'm here with my colleague, Scarlett Flores. We're both from the Institute for Healthcare Advancement, and we are presenting on advancing professional development in health literacy. Before we begin, and we can go to the next slide, Scarlett. Before we begin, I'd like to go over just a few housekeeping items that you may have heard in other sessions today and yesterday. As you know, all attendees are muted during our session. However, we are allowing 10 minutes after our presentation for some questions and answers. So we just ask that you use the Ask Question button on your computer and to ask any questions of us. And if you'd like to have some discussion questions, we have the discussion tab as well. We'll do our best to answer all the questions for you at the end of the session. If we run out of time and have additional questions, we'll be sure to contact you after our presentation. As you know, our presentations are recorded. And so if you miss anything during the conference or would like to go back and review anything that you may have missed or want more information about, we will post the conference recordings about a week or two after our conference. So for today's session, I'll go over quickly our objectives. And Scarlett and I approached this presentation as conference attendees. And we know that after you attend a conference, we feel so invigorated and inspired to learn more and do the great work that we learned about in our workforce and in our professional lives. And so we hope that at the end of this session, you're able to identify at least 3 ways the Health Literacy Solutions Center offers professional growth opportunities, that you'll be able to state at least 2 benefits of completing 1 or more health literacy specialist micro-credentials, and that you'll be able to describe at least 2 ways the Health Literacy Specialist Certificate Program contributes to your professional development. So Scarlett will go over our Health Literacy Solutions site and all the features that are offered free to all of you. And then I'll come back and discuss our Health Literacy Specialist Certificate Program in more detail. So I'll hand it over to you, Scarlett.
Well, thank you for that introduction. And I hope everyone is having such a great time in this virtual conference and that you guys are all learning and also networking. There's a way to network through the conference website and look for different attendees and message each other. But what happens when the virtual conference is over? How can we keep that connection and professional growth? So a way you could do this is by going to the healthliteracysolution.org, which I will be giving a tour for you today. And in this website that we sponsor and administer, it's a collaborative venue that connects all of us in the health literacy community. The Solution Center is a great place to meet your peers, to get and share resources, learn and get answers to your most pressing health literacy questions. It's free and at no cost to you. I'll go ahead and start, let's see, going to that website now so you could see. Okay, perfect. So as a member of becoming a Health Literacy Solution Center, like I said, it's free. You would just need to click this button here and it will take you to a page where it just asks basic information, pretty much your email, first name, email address, and you create an account. It usually takes around 15 minutes for us in the back end to approve it. But once you are approved, you will automatically be entered in the main health literacy community, which I will be going over shortly. But in general, the website gives you access to conference archives, to submitting of resources, to a job and internship board, an expert directory, being able to participate in discussions, and more. So I will go over navigating some of those items today. So 4 ways to connect on the Solution Center. I first want to start off with the health literacy main community. Like I said, once you become a member of the Solution Center, you by default get added to this health literacy main community. And this community operates as the central community for the website. Here on the community's homepage is where you can engage in discussions, share resources, but you have to be a member. So I will log in since I am a member. It will notify you. So I'm going to quickly just put my information here and log in. Health Literacy Main Community. That's the first community in our community portal. And here we are in the homepage. This is where I wanted to focus my attention today. So you could see tabs up here. The first one is the discussion tab, where you could see a list of threads that people have added. And it starts from the most recent to older threads. So you could just browse, and if any interest you, you could just click on it. Like, for example, I'm gonna click on the health literacy and older adults, just so you could see. Here's the main post, and then just people that respond to it. If you're interested in replying to a certain post, you could just click on here and then click reply. Or if you want to reply privately to the person, then you could just reply privately and it will go directly to this person that posted that. So this is a great way to get answers to your most pressing questions. Another way that you could post is by going here. There's a button that says post to the health literacy discussion list. It will automatically be posted on that list. Another thing that's great about this main community is that you could share a health literacy resource specific to this community, and it's like 14.5K members are there, so they would be able to view that resource, and that resource gets stored in the library. Here in the navigational tab, you could click on it and you will see all the resources that have been stored and shared. Now, if you want to see members that are part of the main health literacy community, you can also click on the members tab and it will give you a list of members. I will be going over a member directory shortly, which gives you more of an advanced mode of filtering members that you're searching for. But for now, this is one way. And with that, I want to go back to the slides to hit on a second point, which is the member directory and expert directory. Here you can search for other members and send a direct message. So let's first take a look at the member directory. I have hyperlinks in this PowerPoint, which will take you directly to that page. But let's say that you were in the home page, you would just go up here and on the navigational bar under Connect is where you will find everything that I'm going over today, which is the health literacy main community, the expert directory, member directory. Right now, I'm currently in the member directory. You could do a basic search. For example, let's say you network with someone and you know they're part of the Health Literacy Solution Center, they have membership. You could just search their first name, last name. You don't have to input all of the options here, but as long as you input one or more, it will filter better results for you. And you click find members and it will give you a populated list of all the members that fall under the categories that you typed in. We also have the advanced search. This one helps you find people by bio or demographics. Like, let's say you're looking for someone in Georgia, in Florida. It will give you people that have their bio, or when they filled out their profile, they have demographics under that. So location, country, it could be anything. It could be health educators. It could be plain language, any keyword that you could think of someone that you're looking for, you could type in here and it will just give you a more of advanced search. And now I would like to go to the expert directory. This is new. We have like around a year with this new feature on the Health Literacy Solution Center. And what I really like about this is that you get to look for members that are experts in specific topics in health literacy. For example, you're looking for someone that's in the area of expertise in education, but also in communication. So you would click on those two topics and find experts. And it will give you a list of experts under those topics. And if you want to send them a message, there's the option to send a message. To view their profile, you could click on their name and it will take you directly to their profile, and you could see more information in regards to their bio, their work history. So it's really nice whenever you need someone that has experience or skills in a particular health literacy area. Now, if you're interested in participating as an expert, you could definitely fill out a form here. And if you're not sure which expertise you might fit under, you could click on these hyperlinks and it gives you more of a description of what the expertise under communication is. And that way you're more sure of it. And when you fill out the form, you could pick the correct ones that you fall under. Just note that when we select experts, that it goes through the Health Literacy Solution Center advisory panel, and we let experts know that they've been selected on a quarterly basis, which is February, May, August, and November. And then once they're selected, they will receive an email and they will receive a digital expert ribbon. As you saw when I was showing the list, there was a green ribbon under each picture. So that will identify you as an expert in general on the Health Literacy Solution Center site. And you will be added to this list under the specific category that you fall under. Okay, now moving on to the other way of connecting. Back to my slides. Okay, here we go. So complete your member profile by adding your bio. So yes, it is very important that when you add your bio, because it just gives other peers a better idea of the special skills you have to offer. As I was showing earlier, like looking for experts, I was mentioning that if you click on their name, it will take you to their profile. So let me go ahead and just show that again. So, okay, I'm gonna let's just say I'll click on communication, or I could just show mine. I'll go to profile. And then this is the profile of any member that we have. It will have their bio, their education, their job history. So it's very important that you fill this out. And an easy way to do it is how I just went on to my profile. You would just click on the upper right-hand corner here next to your picture, and then click on profile. It'll take you directly to this. This will probably be blank if you haven't inputted your bio. So you would just click on this pencil icon here, and they will let you add your bio. And a short, brief bio is great. That way it's just to the point. Education, job history, the more you add, the better the better it is for your peers in the community to know more about you. And also when you come up in the search history, it'll just populate more. You can also add your picture. It's always good to have a face to a name, so it just makes it more lively when there's a picture added to your profile. So don't forget to do that. And a way to do that is under your picture, it will probably just be like a gray graphic. You would just click actions, change. It will probably say add a picture if you don't have a picture, or if you want to change a picture, you could just change a picture here. Always keep it updated. Make sure your information is always updated, your email, your work history. And with that, I'll go back to our last but not least item on this slide, which is the job and internship board. This is also fairly new, where you can find or post a job or an internship. It's a great way to connect if you're looking for an employer or an employer is looking for an employee. And a way to get to the job and internship board, like I mentioned, the connect tab here is very important when you want to network or find ways to connect. So this is the last item under the connect tab. We'll click there, job and internship board. And included here on the left-hand side are jobs and internships posted. This one was just posted, well, these were posted 12 days ago. If you want to learn more about it, you would click on the communication specialist here, and it gives you brief information of the job type, the job summary, the qualifications, and towards the bottom of the screen, it will give you a link that hyperlinks directly on how to apply to that job or how to get more information. Now, if you want to post a job or an internship, there's a form on the same page here on the right-hand side where you just fill out basic information on the company, on the job description, when you would like to start showing the job post, when it expires, and submit. And then we receive that on the back end, and we post jobs. We post jobs in like 3 to 5 business days from when you post them. And just keep in mind that the job postings will remain here for 60 days unless requested to be posted longer or taken down. And this is free of charge to members. As long as you're a Health Literacy Solution member, you have access to this, because if you don't you're not a member, it will just prompt you to log in. So that's one of the other benefits of being a member on this Solution Center. Okay, going to the health literacy resources. So we have, aside from the library that I showed you earlier, which was on the main community, that just houses specific resources that were shared there. What we do is we curate those resources, we pull them, and we store them in this main resource library. So it serves as the site's main collection of health literacy resources and tools. And it is open to anyone who wishes to access them. Anyone that accesses the Health Literacy Solution Center site accesses those resources. But if you would like to upload your own resource, share resources, then that's when you would need to become a member. And let's go ahead and review the resource library. In order to access that one, you would just click on the library menu here, and it will take you to this page, and you access main resource library by clicking the first one. Just note that this second one here, the Clear Health Communication Resource Collection, this was a specific collections that were developed in November of 2022 by the Clear Health Communication Collaborative. And it's an initiative with IHA and the Center of Plain Language. So these 3 resource collections just pretty much talk about how to improve your public health communication, especially on the topic of COVID-19. So these are just specific, it's like a specific research collection that we're featuring at the time. But the main resource library is where we would want to go to access all resources. So here at the top of the resource library, you will see featured resources, pretty much resources that have been mostly downloaded or viewed. So this automatically populates. The more a resource gets views, the more it just filters and it just auto-populates to the top of the page. As you scroll down, and you could browse the different resources we have. And on the left menu, we have the 7 topics of health literacy that we've identified, and we've placed and organized resources under those specific topics. So if you click the plus sign here under communication because you're interested in finding resources under that specific topic, then it would give you subtopics that fall under that. Like, let's say you're looking for teach back topics, then you click teach back, and here on the right-hand side, it will provide you a list of all the resources that we have curated and tagged under teach back. It could be webinars, it could be toolkits, it could just be white papers, videos, podcasts. So if you have any resource that falls under teach back and you would like to share it, then you could click up here where it says submit a resource. If you are a member, it will take you to this page where you could put the title of your resource. You leave these 2 options as is. You put the description of the resource, and you select the type of resource that you're trying to upload, whether it's a webinar, YouTube video, hyperlink, And as a Solution Center member, you would just put your email here and next, and then it will upload it. We moderate the library, so we ensure that we tag it on the back end, and in 3 to 5 days, it should be available or sooner on the main resource library of the Solution Center. And another area that I wanted to talk about that is also fairly new is our conference archives. So the conference archives is a central site where you can access content from previous IHA conference, and it is available to members only. Like all the sessions from this conference are going to be recorded and be made available after 3 months in the conference archives. And in order to access the recordings, like 3 months from now, let's say you wanted just to view a recording or a poster, then you could access it there, but you need to be a member. Let me go ahead and give you a tour of the conference archives. That one will live under the Learning Lab. The third item, conference archives. So here's the Conference Archive Central, which is the main homepage. Here you will see the 4 conferences listed that we host or co-host, and just some information on the Conference Archive Central and information on how to access these conference archives. But if you keep scrolling down, it gives you the most recent conferences. Like for example, here we have the conferences from last year, and it's just a quick way to get to last year's conferences. So like, let's say you're interested in viewing HARC's archived content from last year. It will directly take you to here and give you some information on the conference, description of that year's conference, how many continuing educations are still available. Usually they're available 1 year from when the date of the conference was live. If you want to view more information in regards to what CEs are available or how to request them, you could click here, which is the link that takes you to that page. If you want to view the archive content, you just keep scrolling down here. It's usually sorted in alphabetical order. And you just click on any session and view the recording. And then please note that there's also more, so you could go to the second page. Now, if you want to just see sessions at a glance, like get a quick glance of what sessions were given during that time, you could just go here, view agenda. And it's a nice PDF file of an agenda of the titles of the sessions and the speakers. And I just saw a question come in, and I know we said we were going to leave questions towards the end, but I just want to make sure that you guys are aware that the recordings from this conference will be available to paid registrants soon, like in a couple of days, and available on the conference site. So you guys have access to that pretty much like way sooner than anyone else. So we will send an email when those conference recordings are posted on the conference site, but they will be available for you to watch on the conference site. Oh, okay, just got it. The recordings for, oh, okay, they're posted now. Okay, they're there already, so you guys have access to them already. But in 3 months, the recordings will be moved over to the Solution Center, and then that's where others could view it as long as they're members of the Solution Center. So that's a perk that we have for the Solution members. And then going back to my slides. Okay, so with that, there's many more other ways that you could connect in the Solution Center. There's other trainings that we have. There's content that is coming up soon. We have webinars, workshops. So I highly recommend that you do, if you're not a member of the Solution Center, that after the conference you go and you keep connecting and continue professionally growing and learning in this health literacy community. And I'm looking forward to seeing you all there. And like I said, like Rachel said, my name is Scarlett Juarez. I'll put my email in the chat box. If you have any questions on how to create a profile or post a discussion, share resources, anything in regards to the Solution Center, feel free to send me an email and I'm here to help. And with that, I turn it over to Rachel, who will be talking about another initiative, which is the certificate program that's also on the Health Literacy Solution Center. Thank you.
Thank you, Scarlett. I'll share my screen with everyone and start where Scarlett left off. Put it in presenter mode. There we go. Another item that you'll find on the Solution Center site is, this is for more professional growth and development, is our Health Literacy Specialist Certificate Program. And just to give you a little bit of a background, this was an addition, we started this initiative in 2016 with an idea because we saw on our listserv, which is the community discussion forum, we saw just a lot of questions about health literacy and what definition does a person use for health literacy? Because back then we had about 27 iterations of the definition of health literacy. And so we realized that this diverse community that comprised the health literacy community, we had different backgrounds and professions. And you see that when you look at the conference website, when you look at the networking section and you see that people are from public health, healthcare, we have writers, graphic artists. And with so many different definitions back then, we really wanted to create a coordinated effort to determine what it meant to be a health literacy specialist. We knew what it meant to be a nurse or a public health, epidemiologist, but we didn't know what a health literacy specialist meant. And so we explored that idea and we created an assessment-based certificate, which offers you a personalized approach to professional development. Now, in the certificate world, there are certificates for attendance or completing a course where you automatically are sent the certificate for completing it or attending. In our case, it's different. There is more rigor involved in the development process for our program. And so as an assessment-based certificate, one must complete a micro-credential, which is our course, we call it micro-credential, and pass a summative exam of 50 questions. And the reason for that is we use the Institute for Credentialing Excellence, ICE is the acronym, 1100 standards, which provided a criteria for meeting the assessment-based certificate designation. And so unlike a certification, when you complete our certificate program, one does not earn the letters after the name. Our program provides education and information, but it doesn't provide the letters like a certification does. So there is that distinction, but it does require more rigor. And so under the ICE 1100 standards, it required that we convene subject matter experts in health literacy to participate and contribute in every step of the development process. And so like I mentioned, in 2016, we convened a panel of subject matter experts and they met for 2 days. And in that meeting, we posed the question of, what does it mean to be a health literacy specialist? What does one have to know how to do? What are the tasks they have to know how to do? What knowledge do they need? And from that 2-day meeting, they created this team of subject matter experts, created about 7 domains. And under each domains, there were knowledge that each person had to know and tasks they had to be able to perform. From those 7 domains, the subject matter experts started creating the content. And so under ICE 1100 standards, IHA could not create this in-house by just our staff. It had to be through the contribution of the experts. And so we convened about 50 subject matter experts, actually more, around the country and also in Canada. They identified the content, they wrote the content, they peer reviewed each other's work, they wrote the items. We call our test questions items. And so they contributed to writing the test questions, also reviewing the test questions. Another panel met for a standard setting meetings where they looked at every test question, every item in each of the exams and assessed how difficult it would be to answer that question and determined the passing score for that particular exam. And each of these steps required a panel of at least 3, And in some cases, we had about 11 or 12 subject matter experts meeting via Zoom over COVID for approximately 6-10 hours sometimes. So when I'm asked questions about this program and how IHA developed it, I always say IHA oversaw the process. We assisted in it, but our subject matter experts around the country and some in Canada created this for our community. What we created, our SMEs created, were 7 standalone micro-credentials. Originally, we thought of creating one large course with these 7 topics as part of the course, but it just seemed very unwieldy. And so we decided that knowing our health literacy community is so diverse with diverse backgrounds and professions that you may not need to know each of the 7 topics or subject matters in these courses or micro-credentials. And so we decided to create standalone courses. That way it allows you the freedom of choosing the micro-credentials based on your interests and your needs. And I'll show you those in just a second. They're online courses, so they're self-paced courses. We provide 6 months time to complete them and complete the summative exam. Most take a fraction of that time, but they'll complete the exam and they'll have access to the courses for 6 months. For those who purchase the bundle of all 7 courses, we just multiply 7 times the 6 months and you have access to the courses for 42 months. There is a cost involved with the courses and it depends on the length. Some of our micro-credentials are longer than others, and so the cost is a little higher. So let me show you the list of courses. And you may have seen this in Michael Villaire's opening presentation for the conference. He really briefly went over the certificate program, but this lists all of them. We have communication, and everything is communication and health literacy, education, ethics, public health, organizational systems and policies, language, culture, and diversity, and community engagement. And underneath, I listed the number of lessons for each. So you'll see some of our lengthier programs are the organizational systems and policies, and some of the brief lessons are micro-credentials include community engagement and language, culture, and diversity. So let me show you once you complete these courses, like I mentioned earlier, it does require that you pass a summative exam of 50 questions. And so each course, no matter the length of the course, it includes a 50-question exam that a person's given 3 attempts to pass. Once you complete the course and pass the exam, you earn a digital badge. And it's nice because I've seen a lot of digital badges on your social sites, on LinkedIn. I've seen some digital badges in participants' email signature line. So I'm seeing a lot more of the digital badges out there. You earn a certificate of completion and, if applicable, continuing education credits. Right now we offer CHES, MCHES, CPH, and California Nursing, and we're hoping to add more along the way. Now, some individuals choose to take all 7 courses or micro-credentials. And by completing all 7 micro-credentials, we have some participants that'll list the 7 micro-credentials, the digital badges, they'll list all 7 on their social sites or their signature lines. Others prefer to use the digital badge for completing all 7, which you'll see to the right. And so you will earn the certificate of completion for completing all 7 and also the digital badge for completing all 7. So let me go to, I'm going to share another slide with you so I can show you where on our Solution Center you can find this. So I'm taking you back to the Solution Center that Escarla showed you earlier. And just to show you how to find more information about the certificate program, I'll take you to the home page. If you clicked on the Learning Lab that Escarla showed you earlier, towards the bottom, you'll see our program. That's one way of accessing more information. If you scroll to the bottom, you can also access it by clicking on this icon for the certificate program. Here you'll see, and this site is informative. again, allowing you as a potential participant to learn more about it. I mean, it is a paid program. And so of course you want to know what's available for me. How is it pertinent to my learning, to my growth and development? It may also be something that your decision makers at your organization would like to have access to, because I often am asked about the program, and I'll often be asked about groups and group discounts. And these are leaders who want to send perhaps a department to our program and they'd like more information. So I always send them here. We've had several organizations actually include our program as part of a grant. And so they've written the program as a grant, and they're sending groups into our program from hospitals across the nation, also public health departments. And so we're seeing a lot of that, the value in terms of these groups and individuals as well. So on this site, you'll see the information video, informative video, which you've probably seen between the conference sessions yesterday and today. So we provide a quick overview about the certificate. It mentions what I just discussed earlier about your digital badge and certificate of completion. But if you scroll to the bottom, you'll see the list of micro-credentials, and they're listed in no particular order. Like I mentioned earlier, these are all standalone courses. We shifted from having one lengthy course with all of these topics to independent courses, allowing you to pick and choose which one is most relevant for you and for your growth and development, or for your agency. So you can start wherever you'd like. The only prerequisite we have is that you have a basic foundation of health literacy, including the 2 definitions that Healthy People 2030 identified, including how health literacy links to health equity, perhaps who's most at risk. And so just a brief overview. And Michael Valère on our solutions site has a Health Literacy 101, which provides health literacy basics. And it's about 45 minutes. And by just viewing that, it's free to view on the website. By just viewing that, it provides enough information for you to register for any one of these courses. And so you're able to select which course you'd like to begin with, how many you'd like to take. Some of our participants take 1, some take 3, others take all 7. So it just depends again on your growth and development needs and interests. As you scroll down, you'll notice there's a learn more for each micro-credential. Let's click on language, culture, and diversity. This is where it expands to provide you more information. So we provide just the brief overview under the title, but if you look down below, we outline for you each of the lessons within each micro-credential. And we tell you what you'll learn. So you'll see, in lesson 1, you'll learn how to do this, you'll learn. And so this allows you to determine which micro-credential is best for you, or the decision makers at your organization to determine which one is best for their department or their employees. And so every micro-credential does that for you. And so whenever we have any questions, we always refer you back to this website to learn more about it. Towards the bottom, and we do this again for every micro-credential, and towards the bottom, you'll see the list of individuals who contributed to this program. And so we have a thank you and acknowledgement page that lists the primary group who identified the content and wrote the content. There are so many SMEs out there who contributed. We couldn't list them all, but we thank them on this page. And so you can see the list of some of the leaders who contributed to identifying the content and writing the content as well. All right, let me go back to my slides. In terms of using the Health Literacy Specialist Certificate Program, we've developed a framework. We know that Healthy People 2030 distinguish between the 2 definitions of health literacy. And so now we went from these 27 definitions that we had back in 2016 to now our 2 designated definitions of personal and organizational health literacy. Healthy People 2030 states, health literacy, it's not in one of the 5 social determinants of health. However, it's viewed as a social determinant of health. because as we know, a person's understanding contributes to all of these social determinants of health, understanding how to sign up for nutrition programs, how to manage their health care, how to manage their health insurance. I mean, everything is focused on a person's ability to understand and an organization's ability to help their consumers and clients and patients understand. We've also had some organizations who'd like to embed some health literacy descriptions into their job description, or health literacy skills into their job descriptions. And so on the Solution Center site, where we just were, you'll see a job description link where you can download the job description and pick and choose from some of the knowledge and task statements that we included in the job description example to embed into your job descriptions. Because I think more and more, we're seeing organizations that really value an employee that has some of the skills and knowledge related to health literacy. I've also heard of some participants who've used that job description information to update their resumes based on what they've learned in health literacy. And so it works two ways. We also embed these 7 domains or 7 micro-credentials with our annual health literacy conference. And so you'll notice that when you view the sessions every day, under the session, it'll say communication, or it'll say education, or one of the 7 micro-credentials. Because many of our participants have asked for more learning. They've completed the micro-credential and they'd like more information. And so we help guide them through their learning journey by telling them which one of the sessions applies to which one of the micro-credentials. And so we organize it that way. And you notice when the Scarlett mentioned on the website that you can also search for experts in these 7 topic areas as well, or apply to become an expert yourself and have your name listed there as well. In terms of professional development, some of the benefits for you, I've mentioned some already. Many organizations require that employees know how to create accessible health information and know the requirements for that, so we can address every learner's needs. And I know there are some folks here who are students, who are in healthcare, who are in social services. And so I'll talk about clients and patients and consumers because you have different titles for who you serve. But we want to be sure we address everyone's learning needs and make sure the information is accessible for all of our clients and consumers and patients. It also provides professional growth in 7 distinct areas, depending on, again, on your needs and interests. And so some of our individuals are very knowledgeable in health literacy and education, but they want to learn more about ethics and having those hard conversations with their clients or patients. And again, they're adaptable to meet your needs. And so we didn't want to force everyone to taking all 7 courses, but you have the opportunity to decide what is best for you. In terms of the customer benefits and organizational benefits, I think now that we have these 2 distinct definitions of health literacy, personal and organizational health literacy, we're seeing more of an interest in becoming a health literate organization. Even though we've known about health literacy for many years, and we've had the 10 attributes of a health literate organization at our fingertips for many years, there's more of an interest now because the focus before was on personal health literacy and one's ability to understand, and the provider or the provider's ability to confirm understanding. But we know that there's so much more to that. You know, before a person sitting in front of a provider or sitting in front of someone who's filling out paperwork, there's that person they spoke to over the phone. There's a person who greeted them when they walked into the office. There are all the signs around them that guided them to that office. And so organizations are now looking at their client and patient's perspective when they walk into their building, because as employees, we know where we go. But do the signs guide their consumers and their clients and patients to the right location? Did the person over the phone explain properly how to prepare for a certain test or a certain upcoming appointment? Did the signs guide them the proper way using plain language? So there is so much more involved. Are there policies at the C-suite level on health literacy or embedded into the strategic plan? And so by taking some of these courses and having some basic knowledge and having employees from different areas, different departments of the organization, we know that can improve patient-provider relationships. Dr. Coleman discussed this yesterday about communication at all levels, including patient portals, including the information on websites, information that's mailed to a person's home. And so it involves the entire organization. And we know that through better communication, we have better healthcare management and outcomes. I think we've all been there when we've had a new diagnosis, or our child or spouse or parent has a new diagnosis, and you're confused and you're worried. And it's nice to have someone stop and speak in plain language and confirm understanding. And so again, that's happens, that's system-wide at the organizational level. And so I think we're seeing a lot of organizations who are going in that direction of becoming a health literate organization. In terms of completion rates, as of last month, and the numbers keep increasing, which is wonderful. But as of last month, we've had about 1,200 people who've completed at least one micro-credential. And we've issued about 7,000 micro-credentials, over 7,000 micro-credentials total. We've had about 226 complete all 7. Given that the last micro-credential was launched in December 2021, so it's been almost a year and a half that we've had all 7 available, that number is pretty good. And again, it's not everyone's desire to complete all 7. So it depends on the person's, again, professional growth and development needs and interests. But what some of the individuals are saying about the program, I pulled a few testimonials. One says, I'll continue improving processes in my workplace to better assist LEP individuals or limited English proficient individuals, facilitate staff training, and write policies. And so we're seeing someone thinking about their entire organization, how to make this workplace better to assist their clients and patients through staff training, looking at the lens of their participant or client, and looking at the policy level as well. Someone else that'll try to speak and write in plain language. I'll also continue to check my biases and support others. And how many of us, we all have that language that we speak to each other in our offices, our colleagues. We have acronyms for certain things. We have our jargon that we use, whether it's medical jargon or just your inner office language. But how often do we use that language in front of our clients or to speak to our patients? And so I think when people go through our program, they realize, gosh, maybe I am using this jargon that my colleague understands, but my client does not. And so they're checking themselves and checking the terms they're using. Someone else says the courses were comprehensive, easy to follow, and included a lot of helpful information to inform my work in health literacy. And it's nice to hear that. It's nice to hear that when you go through the micro-credentials, especially when there's 10 lessons or 8 lessons or even 5 lessons, that our participants are finding it easy to follow and they're having a positive user experience, which was what our goal was from the beginning. One of our subject matter experts who oversaw the writing of all 7 micro-credentials, Jan Keenan, was the lead SME for the content writing. And so when our SMEs would complete their sections, they sent it to Jan, and she would put a health literacy perspective to that information. And she ensured that all the information that was written and designed using health literacy principles. Now, it's not written at the 3rd to 5th grade reading language, because we know that, or the 4th to 6th grade reading level, because we know that professionals expect more, but we know that we have some folks who are new to the field. And so just like in health literacy, if there's a term that's that's not broadly used, it's defined. So when you look at our courses, and I'm going to just show you one page of one of our courses for language, culture, and diversity. And I had to minimize the page for this screenshot to fit as much as I could onto the screenshot, but it's typically a lot larger when you look at the courses. But Jan Keenan, who oversaw our writing content experts, our writing SMEs, was very strict about how to design this. And so you'll see that we have titles, we have subtitles, we have the white space, the bullet points. And so everything exemplifies health literacy, even down to the graphics we chose. There's certain criteria to choosing graphics and health literacy that we cover in the communication microcredential. And so our hope, our goal was that our participants recognize that as they go through the microcredentials, that we kept true to health literacy and the writing and design principles of those courses. So to wrap up and leave time for questions, again, we have this great website, Health Literacy Solution site, where there are so many other learning opportunities for you post-conference and ongoing, and they're free webinars who are hosted by other experts in the field. You can contribute to the resource library, so our community contributes to that. And with our microcredential, this was something that the subject matter experts in our field across our country and in Canada developed for all of us. And so you can access all of that through the Health Literacy Solution site. So I'm going to stop sharing and see if we have any questions. I haven't paid attention to our chat quite yet.
There's some questions in the Q&A,
Okay.
and I think they're for you. Let me know if you want me to read to you.
I see one from Christy. Are your courses accessible for individuals that are blind or have limited vision, JAWS system compatible? This is a question we received from a partner. Christy, we're looking for an online site. I believe Storyline was one of the sites that claimed to be accessible, but it truly was not. And so we use RISE, that's our platform for where the system was built. And so we're looking for a truly, it's not accessible to blind individuals, although I believe through certain services, they can have the information read to them. But we really do need a platform where we can do that and be successful with all the learning challenges out there. So that's a really great question, Christy. Marcy asked, hello, are we assigned a mentor or someone to speak with, to have guidance with when we register for a microcredential area? That's a great question, Marcy. And I don't know if this is something, Scarlett, that we could maybe utilize through the Solutions Center, through the experts that are experts in the areas. We haven't explored that idea, Marcy, but that's a wonderful idea that we can explore later. Scarlett, do you know of do we have any mentorship available through the Solutions site?
Not at the moment. We only have the expert directory, but it's definitely something that we could keep in mind. And if there's a possibility with the platform, and there will be more information about it if we do end up. I think that's a great idea.
Yes, thank you, Marcy. And I see you have a follow-up question. Are all 50 questions derived from the info found in the lesson for each microcredential, and what is the passing grade? Yes, Marcy, all the information, we have every question in our exam is mapped to a specific learning objective. And so we had one of our consultants who is a psychometrician who did all of the math for us and made sure that every question is linked directly to our course. There's a different passing grade for each course for the 50 questions, depending on the rigor of the information. And so that was one of the tasks that our standard setting subject matter expert panel met for about 5 to 7 hours. A group of about 12 individuals assessed every single question and all of the distractors, the possible answers, and assigned a difficulty level to it. So there's a certain process that we had to follow for the ICE 1100 standards, but that's why each of the microcredentials has just a varying passing score, probably about 1 or 2 points off, depending on the course and the question rigor. But you are given 3 attempts to pass each exam. And we haven't had many participants, maybe 1 or 2 in the past 2 years, who asked for an additional 1 more exam. But for the most part, 99% of our participants do pass within the 1 or 3 attempts. And Diana is asking a question of, I believe is it Marcy, Diana, that you'd like to reach out to get more information? Okay, so Marcy, would you mind, either you could email one of us, you could email, my email address is rroberts@ihaforhealth.org, and I can put that in the chat as well. Or Scarlett, which is E. Juarez, and I believe you're going to put it in the chat as well, E. Juarez@ihaforhealth.org. But if you
Yes, I
could,
put it
Marcy,
there.
okay, thank you. Marcy, if you could send us your contact information, we love that idea. We'd love to explore it more and talk to you a little more. I see, oh, that was already answered. What other questions do you have, I should say? These are some excellent questions and suggestions.
One of the questions that I typed an answer for was, how does one become a member of IHA? And I put the link there, which is the healthliteracysolutions.org. You would just click a button that says become a member, or log in, sign in, and it will take you to a page where you could create your account at no cost to you.
All right. Do you have any other questions? And thank you, Marcy. I see your information that you posted for us. We really appreciate that. I don't see any other questions. Do you have anything else to add, Scarlett, to come to final thoughts, or you're on mute?
At this time, I don't have anything else to add, but I just really encourage everyone to keep connecting on the Health Literacy Solution member. I'm looking forward to seeing you all there. I know we have, time is kind of running out, but if you don't have any more questions, I really appreciate the time and attention for you being here today.
Yes, definitely. Thank you. And don't forget to also network on our conference website. You can look at who's attending and connect that way as well. So several options to connect. And thank you for being here. I hope you have a wonderful rest of the conference today and tomorrow, and look forward to seeing you on the solution site. Thank you so much.